Hello, I'm Dr. Steve Lipinski. It is estimated that obstructive sleep apnea occurs in some 24% men and 9% women in the North American population. Only 1 in 10 are diagnosed. This not only poses as a serious health epidemic, but a social risk as well. Obstructive sleep apnea is highly correlated with high blood pressure, heart disease, and weight gain. It is also associated with memory decline, anxiety, depression, and excessive daytime sleepiness. This may lead to more mistakes at work, more sick days, and inattentiveness, for example, feeling sleepy while driving an automobile. In a nutshell, obstructive sleep apnea is the inability of the upper airway to remain open while sleeping. This interrupts and fragments sleep. It usually presents with loud, repetitive snoring, pauses of breathing, and sudden gasping for air, sometimes waking up choking. Oral appliances are increasingly becoming a convenient, effective, and viable treatment alternative. Oral appliances work by moving the lower jaw forward, lifting the tongue off the back of the throat, thereby increasing the size of the airway and allowing room for air to pass. There are also many neural, hormonal, muscular, and skeletal factors involved in maintaining the airway during sleep as well. This is a plastic model of the face. Here's the nose, nasal cavity, tongue, the mouth, lower jaw, and the airways back here. As you can see, this airway is almost entirely closed. Oral appliances work by moving the lower jaw forward, thereby opening the airway. There are many different types of oral appliances used in the treatment of snoring and obstructive sleep apnea. This one is made from hard acrylic. This one, softer, more elastomeric material. This has metal in it. And this one is made from milled nylon using CAD/CAM and 3D printer technology. The type of oral appliance used is specific to you based on your general and oral health, so that side effects may be minimized. Obstructive sleep apnea is a serious medical disorder. It is diagnosed by a physician familiar in sleep, an ear, nose, and throat, or medical sleep specialist. Treatment is prescribed by a physician familiar in sleep, an ear, nose, and throat, or medical sleep specialist. When consulting with your medical sleep specialist, ask for a prescription for an oral appliance. This is the time to discuss your treatment preferences. If you are faithfully and regularly wearing a CPAP, then by all means stay there. You can always have an oral appliance fabricated for travel. However, if you cannot or will not wear a CPAP, then an oral appliance is a viable alternative. Qualified dentists who fabricate oral appliances for the treatment of snoring and obstructive sleep apnea have received serious training in dental sleep medicine and remain abreast of the current research. A good place to find a qualified dentist is to click on the link below that will take you to the website of the American Academy of Dental Sleep Medicine. I will be posting to my website regularly as current research becomes available. I have a blog for patients as well as one for health professionals. Research in the field of dental sleep medicine is rapidly and continuously evolving and is increasingly showing that oral appliances are a convenient, effective, and viable alternative in the treatment of obstructive sleep apnea and snoring. Please feel free to contact me or any one of my team members. It would be a pleasure to hear from you.